Hello, my name is Eric Booth, and today is August 18th, 2020. Hopefully, you guys can see that a little bit better. Welcome back to my YouTube channel, Dr. Delavicia. Like and subscribe. I think you forgot on the last video, but I forgive you. So, today we'll be talking about the Unit 4 case studies. I chose to answer 1 and 3. I guess Pouty the Gouty Clown is 47 years old. But, anyways, let's delve into case 1. So some important information on case 1 we should gather from the prompt. We know that the patient is lethargic, hypothermic, and experiencing apnea. Her blood ammonia levels are 314 micrograms per deciliter to start and rise to 600 micrograms per deciliter. Her uric acid levels are elevated at 473 micromoles per liter of creatinine. However, her plasma citrulline levels are normal at 10 micromolar per liter. So we have 4 choices of disorder here. This test to see if the patient is experiencing a urea cycle disorder or a beta oxidation disorder. The 4 choices are blood glucose, urinary acids, serum fatty acids, and plasma glutamine. So I'm just going to come right and say the best diagnostic tool is probably a plasma glutamine test. Plasma glutamine is the only test that would test and indicate a urea cycle disorder or a beta oxidation disorder within one test itself. Glutamine is important for the clearance of free ammonia. Ammonia is very toxic, and glutamine is a great antioxidant. If there was a defect in the urea cycle, we would see an increase in free ammonia and plasma glutamine. So if there's a defect in beta oxidation, the glutamine levels would remain normal. The other choices are not appropriate to test for a blood urea or a urea cycle disorder. Testing blood glucose would be pointless since blood glucose is not irrelevant to the urea cycle at all. The urinary acids would indicate citrulline levels but do not denote a change in beta oxidation. So on the contrary, serum fatty acids would address fatty acid deficiency but not the urea cycle. So glutamine test is really the only one that would tell both. So the lab report, here, let me slide down a little bit. The lab reports confirm an OTC or ornithine transcarbamylase deficiency. According to NORD, this is an X-linked trait. In boys, we see high serum ammonia levels, and in girls, we see hyperammonemia, lethargy, and apnea. All of these symptoms are seen by the baby, and she's female, so it fits. An OTC deficiency triggers an increased carbamyl phosphate level. This in turn raises uric acid in urine. That's what differentiates an OTC deficiency and why it's not a CPS1 deficiency. We then see uric aciduria and academia, which are seen by the baby as well. So let's move on to case 3. Again, we always start with pertinent information. So we know that the patient is diagnosed with gout. He has increased levels of plasma urate, decreased uric acid levels, and stated his diet consists of 4 to 5 liters of soda a day, which contains high fructose corn syrup. So there's 3 possible cases of gout, like reasons for it. So when assessing for gout, we usually look for an overproduction of purines, decreased salvage of purines, or decreased urinary excretion of uric acid. A study in 2012 stated there's about a 90% chance of the diagnosis being decreased clearance in the urine. Sorry, let me slide to case 3 here, wherever it may be. So after evaluating the patient's tests, he is a part of the 90%, which means he has an increased production and decreased clearance. We know this because a normal level for men is 7 milligrams per deciliter of uric acid in the blood, and the patient is up 3.5 milligrams, which is the value here. He's actually at 10 milligrams per deciliter. So the body carries the uric acid in the blood and is processed by the kidneys. So when there's an excess, it's not clearing as fast, and it leads to depositions in certain joints and kidneys. Usually the big toe is the first place people experience a gout attack, and pretty well correlated. So the clearance is usually due to an impairment of the kidneys due to a disease, or more likely a high purine diet. So when thinking of gout, many people think of red meats, and they'd be right. Red meats contain a lot of purines and lead to a lot of uric acid. However, Mayo Clinic stated that other large factors, are actually the game, organ and meat, or organ and game, sorry, types of meats. So all of your red meats. So specifically like cows and deer. There's other certain types of fish, juices, particularly fruit juices, soda, alcohol, and many more specific examples and many more food types. As we know from the man's verbal, he is drinking 4 to 5 liters of soda a day. To be put in perspective, that's literally an entire case of Coke. I don't know how he's not even getting sick of it, but that's a lot of Coke. So these types of foods are metabolized into uric acid. So when we eat a lot of them, we would have more uric acid. Thus, it increases our risk for gout. Makes sense. So statistically speaking, alcoholic beverages are usually the trigger for the first gout attack, for usually alcoholics and people who like to have glasses of wine and other beverages with their meals. However, with some simple modifications, a man can live a happy, healthy life. So yes, Pouty the Gouty Clown will be able to perform again. The obvious change is decreasing his intake of all said food and food groups previously mentioned, so all of the red meats. He should swap red meats for lean meats such as chicken, and of course having a few less drinks. He might be having too many mixers at those parties that contain soda. So decreasing simple sugars in those drinks and replacing them with complex carbohydrates by eating, whole grain pasta and all of the other delicious foods. Again, the easiest modification would be swapping his case of soda a day for even decreasing it to 1 to 3 cans a day and replacing the rest with water. And there is a study out there that suggests that a vitamin C supplement would also increase his uric acid clearance and decrease gout attacks. So we know that it's not a decreased clearance, and it's not an overproduction and decreased salvage of purines from the test alone. We just don't have enough information to assume that it is one of these options. We need more information before we could say otherwise. We would start by looking at past medical history and family medical history, because gout often runs in the family, and a previous positive may be an indication for an unfortunate trait passed along. If all negatives, though, we would be looking for the specific test of the HGPRT deficiency, which is short for hypoxanthine guanine phosphoribosyl transferase deficiency, and that enzyme. So since we don't have that test, we can easily assume that it is just a decreased clearance of uric acid in the urine. So here are my sources, and as always, if you have any questions, please put them in the comments, like and subscribe, and I'll see you guys soon.